sir. Okay. So, good evening, everyone. Welcome to Vayomanasa Sanjeevani Monday webinar series. Today's topic of the day is about yoga. To talk about this, we have Dr. Lakshmi Nishitha J. I welcome Dr. Lakshmi to the session. And I would like to welcome, and today's moderator for the session is Mr. Jampunathan. I also welcome him to the session. For introducing him, he is an active volunteer of VMS. And I also welcome all the Zoom and YouTube participants to the session. On to you, Jampunathan, sir.
Thank you, Lima ma'am. Namaste. Good evening to Dr. Lakshmi Nishitha J, Mrs. Lima, other students and staff and volunteers in NIMHANS, the viewers and participants for this webinar from across the country and other parts of the world as well. I have great pleasure in welcoming you to yet another edition of the fortnightly seminar being organized by Vayomanasa Sanjeevani, an outreach arm of Geriatric Department of NIMHANS, Bangalore. I have great pleasure in introducing to you Dr. Lakshmi Nishitha J, the resource person of this evening, who is going to talk on yoga. And to talk about, she is a highly accomplished and educated doctor. To talk about her, I will say that she is an young and highly educated doctor, having a master's degree qualification from renowned Swami Vivekananda Yoga Anusthana Samsthana, shortly known as S. Vyasa University, postgraduate certification in acupuncture, and she has ongoing studies in PhD in integrative medicines with NIMHANS. She was also a gold medalist in her graduation level. The doctor is a specialist in thermal imaging and analysis, besides evidence-based yoga therapy. She has several publications to her credit. She is also a Google Scholar in publications. We are really fortunate to hear and benefit from her knowledge and evidence-based studies and know how yoga can support us in our day-to-day life. As a time management tool, I request participants to ask the questions in chat box for her to answer. You may also raise your doubts after the resource person finishes her presentation. Yes, Dr. Lakshmi Nishitha, the floor is now open to you. Please go ahead.
Thank you so much, sir, for a very wonderful introduction. Very humbled in front of all of you. So today we will basically look at an overview, mostly like a bird's eye view of what yoga is. Then we can also look at some doubts and clarifications that you have from your side after that. So to start with, I would start with what is yoga. So before I move on to the topic, I would ask some of you to unmute and tell me, what do you understand by the word yoga?
Yeah, participants can now say what they understand by yoga. For Dr. Talks.
Anybody who wants to volunteer and answer?
Keep fit physically and mentally.
Madam, they say that yoga is the union of Jivatma with Paramatma.
Oh, great. Yes.
For that, many methods are there.
Yes.
We have to follow that.
Super. Very nice. So basically, what yoga is, many of us, when you talk to people, they have a idea that either yoga is just all about asanas, or sometimes they think it is sitting in a corner, leaving the entire family or responsibilities, and then they're sitting with their eyes closed. Complete renouncing is yoga, and few people think meditation to be yoga. So what actually yoga is? Let us look at it. So this is the definition of yoga that one of the very ancient sages, who's also known as the father of yoga, that is sage Patanjali. He has mentioned this in his Yoga Sutras that has been written in 400 BC. So he defines yoga as yoga chitta vritti nirodha. So yoga, chitta is the mind, vritti are the fluctuations in the mind, nirodha is termination, or completely removing such waves or fluctuations in the mind. So yoga is basically the termination of the agitations or the fluctuations of the mind. Now, how many people think that is there really a difference between yoga and exercise?
Yeah, you can respond. People can respond.
If you cannot unmute yourself, you can put it in the chat box as well. I am also reading the chat box.
Yoga and exercise is totally different.
It's totally different. Thank you, Ganeshji. May I know why you think it is different?
Because yoga is we are doing in a relaxed as well as it's related with the mind. But the exercise is burning more calories, and we just concentrate to build our body.
Okay.
In my opinion, yoga, apart from including the physical exercises, emphasis is given for the breathing also. The process, the process basically differs in that. And obviously we gain flexibility, and apart from visible differences in the physical capacity, yoga gives total energy. I mean, I'm not getting the proper words to. In large, I can say like that.
Yeah. So yoga is more holistic.
Yeah, exactly. That's it.
Yoga, we can assess our breathe in and breathe out. While doing exercise, we just can't treat the inhalation and exhalation. That's a difference.
The combination of
Ganeshji, you want to say something, Ganeshji? Oh, Maniji.
This is exercise is basically to focus on something with respect to body only. Yoga is both with body as well as mind, and union with the eternal things, joining with the nature.
the combination of the asanas and the pranayama.
It's a combination of asanas and the pranayama. You mean to say that there is a inclusion of breath component?
Yes, yes.
Okay. So, yeah, I see that most of you already know a lot about yoga.
So in fact, there is one more reply in the chat box. Yoga is the fund of exercises. That's what they say. Yoga is a kind of exercise as well as mind to be integration. In fact, also talking about almost the same thing, integration of the mind and exercise.
Yeah.
But I mean, doctor, I tell you, I have got one problem. See, in exercises, don't we include our mind there?
So in most of the time, most of the exercises that you do, generally there are a few exercises which involve mind. I mean, you concentrate on a certain aspect of your muscle, but however, you still don't coordinate with the breath. But a lot of time, because of the pace that the exercise goes at, it is difficult to keep your mind engaged throughout the process. As a result, the mind wanders. The mind wandering is more, in a few exercises, and that is the reason also a lot of people use, different inputs like music or different things to keep them more engaged. So such things, that is where it differs here in yoga, that there is both the coordination of, so there are three components. There is body, there is breath, and also the mind.
Thanks, sir. It explains.
So briefly to, I kind of put everything into a slide. So, the action wise, the movements, especially in exercise, are very dynamic, but in yogasana, it's very steady. There is no dynamic yogasana. So all these variations that have come up, hot yoga, power yoga, beer yoga, all of these are not yoga. So yoga in its traditional form is done steady, a very balanced.
I request all participants to mute themselves. Rima ma'am.
Yes, sir, I muted out.
Please, ma, please. I am not getting the power.
Yes, sir. I done.
Enablement. Can you go ahead? Sorry for the disturbance.
No problems. Further, the movements in the exercise are more, associated with speed. And however, in yogasana, it is slow, rhythmic, and steadiness. And the movements in exercise are isotonic. But in yogasana, it is more isometric. Isometric in the sense, the length of the muscle is not changed. The length of the muscle is always the same. The tone increases. However, in the exercise, there is a lot of stretch in the muscle fiber. And the heart rate increases tremendously in terms of exercises. However, in yogasanas, there is a very slow and steady raise, and it maintains, and after the yogasana, it reduces. The same happens with the respiratory rate, also with the blood pressure, and also with the metabolic rate. And this is the answer that all of us agree with. Mind, it has a lot of, it keeps wandering when we exercise. However, because there is a constant effort of synchronizing the body and breath in yogasana, so there is more body and breath involvement. Okay. Now, before we move ahead, can I understand how many of you think that there is any connection between the body and the mind? Is there a connection between your body and your mind? Like if you feel a certain way, does your body respond in a certain way?
Yes,
Yes.
Definitely,
Yes.
whenever you get angry, you breathe very fast.
Yeah, breathing is related to body and mind. When we are happy, it's
I'm not asking breath, I'm asking mind and the body.
Yeah. It's a feeling mind. If the feeling is there, that definitely it reflects on body.
Okay. So can you give me some example?
Yeah, that's what I
mindful eating.
Yeah, how does mindful eating have an influence?
Happy to eat. That's make our even we are eating little also we feel fulfilled.
Okay. So how many of you, can you tell me when you're happy, how does your body look like?
It's balancing the hormones.
No, I'm asking when I look at you, how do I know when you're happy? Okay, when I see you sad, how does your body feel?
Facial expression, like, while we are happy, we can see a smiley face, and the glow we can see it on our face.
Not the face, I'm asking down, generally when you're sad, you are not open to talk to anybody. You want to be close. You are like this.
If you are
Lonely.
sad, if you are
Loneliness.
sad, if you are not happy, your shoulders will be brooding.
Yes, exactly.
A little bit. Whereas if you are happy, you will be up. You will be upright.
Yes. Does it look something like this?
Yeah.
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 Loneliness will be sad. When friends are with us, or close relatives, or son, daughter, grandchildren are with us, we will feel happy.
So how your body reacts, that is what doctor's question. How your body reacts to your happiness. How your body reacts to some of the sadness.
No, body is a chemistry factory. When we
Body
feel
is
sad,
more stiff than the
body will aggravate other things. When we feel
more
happy, calmness will be there.
You
And
feel that you
happiness-
are light. In the body itself, we feel that light when we are happy.
Yes.
But that's sometimes very difficult to express it also, show it or whatever. This one. It may not be visible also sometimes for the other person.
Yeah, not as much as what are seen in the picture. This is for understanding, but mostly when you're happy, you're more open, you want to meet people, your shoulders are nice, open, your chest is open. When you're actually sad, you kind of hunch down. If not sitting like this, but you still hunch down. You're not happy with anything, you're not feeling interested. Your shoulders are drooped, your face is down, your eyes look dull. Yes.
And you start also brooding.
Yes. Yeah. So definitely, when I asked about the body itself, everybody has told about the breath. So definitely breath has a lot of influence, right? So your breath can show a lot of emotions. So when you're, silent, meditative, your breath happens in a certain way. When you're joyful, it happens in a certain way. When you're absolutely, excited, it is in a certain way. When you're fearful, it happens in a certain way. And when you're angry, now everybody knows how your breath goes. Yeah, your nose flares. So definitely, now that we know that the way we feel in the mind definitely influences our body and our breath. So now, can we use this body and our breath to, do a little manipulation at the mind? Now that there is a connection, till now, the mind is influencing your breath and your body. Now, can we use this body and the breath to influence the mind?
Yeah,
It's
this
possible,
is the
right?
reverse process you have to do.
Yes, so it's possible, right?
Yeah.
So that is what yoga is trying to do. Okay. So now there are two basic schools of yoga. One is Patanjali's Ashtanga Yoga and the other one is the Hatha Yoga. Okay. So first yoga that was introduced was the Ashtanga Yoga, Patanjali's Ashtanga Yoga, which was more difficult and rigorous. Okay. So it has a lot of codes of conduct that you have to follow for yourself, for the society. Then there is asanas. So there are 8 limbs of yoga. There are asanas, there is pranayama, there is pratyahara, and then 3 steps of meditation. Now, this form of yoga was found very difficult for many of the practitioners. So later, the Nath cult has come up with little simpler forms, simpler and body-based methods of yoga, which is the Hatha school of yoga. Okay, and this has a lot of emphasis on the practice component, especially on the asanas, pranayama, and the Shat Kriyas. Shat Kriyas are basically like a cleansing techniques that we use before we start the process of yoga. You might have seen, the Jalaniti pots where people cleanse, put saline water from one nostril, the water flows from the other nostril. Yeah. So and then there is different types of, Trataka Kriya. There are different types of cleansing processes that have been mentioned in Hatha Yoga. So this is Patanjali's Ashtanga Yoga. As you see that it starts with yamas. These are the code of conduct that you follow for the society. Okay. So it involves ahimsa, that is non-violence, satya, telling the truth, then asteya, that is not stealing, not keeping what you have for yourself, rather than it could also be like a thought or an idea that you're stealing from other. Okay, all of these happen at body and also the mind. Okay, it is body at the level of speech and at the level of mind. So these can happen on all the three levels. And then there is brahmacharya, where it's about living in moderation. And then aparigraha, that means non-hoarding or not keeping all the things for themselves. Then comes the niyamas. These are the individual code of conduct, maintaining cleanliness of your body, of your speech, and of your mind. Then santosha, the being happy with whatever you have. Tapas is basically doing your sadhana with intensity. Whatever comes, you still do your sadhana. That is tapas. Then swadhyaya, after the your sadhana, you look into yourself and actually see where you are actually progressing. And then you do Ishvara Pranidhana. Ishvara Pranidhana is trying to surrender yourself to a higher principle in life. It could be God, it could be anything that is bigger than you. Okay, so that is Ishvara Pranidhana. So these are the code of conduct. It starts with this, and then we have asana. So asana is the physical postures, and most of them limit their understanding of yoga to asanas, which is not, but it is beyond asanas. Then there is pranayama, where we use breath as a tool to actually bring the influence on the mind. And there is the fifth one is called as pratyahara. Pratyahara is basically a process where all your senses are basically looking for some sense object outside. So in this step, all your sense organs are turned within you, looking into you. Okay, that internalizing of your senses is called as pratyahara. So this is a step from where actually the meditative processes begin. Okay, so once you internalize your senses, then there comes dharana. Okay, dharana is basically trying to concentrate on something or on some chakra or on an object that is inside you. Okay, and then when dharana you do it continuously, when you focus on the object continuously, there comes a stage where you actually enter the state of meditation by itself, where that is called as dhyana. And finally comes the samadhi, where you become one with the object that you started your dharana with. Okay, so everything becomes one, and you as a separate entity do not exist. So that is called as samadhi. So these are the five, these are the 8 steps or 8 limbs of yoga. So as you can see that, we voluntarily can do the first 6 steps. When you do these continuously, automatically the dhyana and samadhi happen on its own. when the practice is continuous and sustained. Okay, so this we have seen yamas and niyamas. Now, basically, when you actually put everything together, this Ashtanga Yoga is basically trying to centrally act on the mind. Okay, the social conduct, the bodily postures, the pranayama, or the pratyahara, the dharana, dhyana, everything is to basically centrally focusing on the calming of the mind. Now, the other thing that is very important is this model of our existence has come from the text called as Taittiriya Upanishad. Okay, so in this Upanishad, basically, our entire existence or our existence is described in 5 koshas or 5 layers. Okay, so now the physical body that we see is called as the Annamaya kosha, or the physical body, you know, which you can see with your naked eye. Now, obviously there is a difference between the body, a living body, and a dead body, right? So now, what is it that makes a difference? How does a dead body differ from a lively person?
The dead body, there is no breath.
There is no breath, right?
Prana.
So now, how, from where the breath is happening?
It is from the body itself.
But the body is dead. From where is it happening?
Very good question, Ma.
This is before death, no. Once it's dead means there is no happening of breathing or prana. Before death, prana is there. Once prana is gone, body is that's
dead.
But
the body is still there. You can see the body, right?
Yeah, but it is not breathing. That whatever air breathing is that.
What is it that makes the difference?
Why it is not breathing? That's what doctor is asking. Why it is not breathing? Why the body has suddenly stopped breathing?
So prana is gone, right?
Because there is no Atma.
There is
no.
Around.
Right?
The soul is hovering around.
Sorry?
The soul is hovering around the body.
Madam, there is no Atma, so there is no requirement of any breathing in that body.
Okay, I'll ask you another question. Now, there are a lot of Atmas that are there around, okay, especially in the cremation ground, right?
That's what we say, that's what we hear.
Yes. So then what is it that is stopping that soul not to go into the body? Complicated. So let us not complicate. See, when a person is dead, what do you say? That prana has gone, right? Prana Shakti has gone.
Yeah.
Yes?
Yes.
So the force that can actually hold is gone. Right? So this force is the vital force, the prana. This prana actually is a very subtle energy that does a lot of functions for us, which manifests for us as if it is happening in the body through some bodily mechanisms. But no, it is much more subtle and it happens through the pranamaya portion, which is the energy body. Okay, so this part of the body, basically, you know, you would have heard about nadis, chakras. So all of this anatomy happens in the pranamaya portion. Okay, so there are channels that actually conduct this energy, and wherever this the channels meet, the crisscross point of that channel is called as the nadi. And there are a lot of more than 72,000 nadis that have been mentioned in ancient yogic texts, out of which the junction of 7 chakras have been, given a lot of importance. Okay, the 7 chakras are basically the major centers that happen in the mid of the body. Okay, so there are there are nadis that are there only on your right side. There are nadis that happen only on your left side. And when these nadis crisscross each other, in the center, they form chakras, the 7 major chakras. However, apart from the 7 major chakras, there are many more chakras wherever the nadis kind of cross over. Okay, so now in this energy body, there are different types of prana that happen. Okay, there is a certain kind of prana that helps in regulating the downward functions in the lower part of the body, like your excretion, urination, childbirth. All of this happens due to one particular prana. Your digestion happens due to another kind of prana. So there are 5 pancha prana that have been mentioned that regulate different parts of your bodily functions. Okay, now this prana, subtler to this prana, there is something called as manomaya kosha, which is the body of emotion or the body of mind. Okay, so this particular body basically acts as a director to the pranamaya kosha. Okay, so you see that a certain kind of emotion can bring in certain kind of physiological function. When you're angry, you're able to actually raise your blood pressure, you're able to raise your breath rate, heart rate. Now, how it is getting converted is through pranamaya kosha, but it is manifesting in your physical body, right? Now, how the emotion is connecting to your physical body is through this model. Okay, so this emotional body is like a director to the your pranamaya kosha as well as the annamaya kosha. So these are the 3 layers which are very important for the yoga therapist. Okay, so at annamaya kosha we do the cleansing practices, the asanas, and at the pranamaya level we do the pranayama, the breath-based practices. And for manomaya kosha, we do relaxation and meditative practices. So when we are trying to act on these 3 koshas, then there is a balance that happens in your vijnanamaya kosha and your anandamaya kosha. Okay, so vijnanamaya kosha is much subtler to the mind, which is the layer of your intellect, and beyond that is the layer of bliss. Okay, when you listen to the ancient stories, or the people people who have lived before us, or very old people, they have a very strong intuitive processes that they can actually tell what is going to happen. They're able to actually sense a lot of things. Okay, so that kind of intellect they have because they're there was so much balance in their first 3 layers that they were actually able to clearly see their wisdom or the intellectual layer. Okay, so once you're able to have better control over the first 3 koshas, you're able to access your intuitions or your intellect better. And when you're able to actually regulate all the 4 koshas, then there is nothing that can stop somebody to be actually happy and blissful, because that is the ultimate nature of all of us. Okay, when you are just left to be, you always would want to be happy, right? Nobody wants to be sad. That is, every one of us are seeking nothing but bliss or happiness. So that is the ultimate nature of our existence. So now you see that these are the different components that we are acting at with Ashtanga Yoga to bring balance in this koshas. So very briefly to tell you that these 8 limbs of yoga actually bring a lot of balance in the chemicals that are released in the brain and a lot of neural pathways, and ultimately reduce depression, reduce anxiety, reduce negative symptoms, negative thoughts, improve cognition, improve sleep, and improve attention. Now let us also see the other definition of yoga. Yoga actually comes from the root word called yuj, yuj meaning connection or union. Okay, now what does this union mean? Yes, definitely the union between the Jivatma and Paramatma, that is nothing but trying to feel the oneness with everything that is around, right? And also trying to feel the union between your body, breath, and your mind. Now this very model, I want you to see this model carefully. This has emerged from the interview of patients in a research study, where the most commonly reported benefits after the yoga practice, people were reporting improved calmness, improved mindfulness, improved compassion with self and also others, and sense of connectedness. Okay, so when these all components come together, they actually improve the connection with the self and also with everybody around. Sometimes it happens that when we are alone, we really don't feel good. We're not able to actually establish a good rapport or good relation with our own self. So this very study actually tells us that with the practice of yoga, you actually also build a good relationship within yourself and also with everybody around, and that actually enhances the global well-being, health, and other health and other wellness outcome that come from yoga. So these are the general benefits that we see in the healthy population, where there is they report that there is reduced depression, reduced anxiety, there is increased quality of life, there is better performance on any psychological test, and it reduces stress hormones, it reduces oxidative stress, and it actually improves the gray matter of the brain or the brain volume. Now, why yoga for elderly? Especially because yoga is something that actually can integrate your body, breath, mind, and your emotions, which is very important, especially in the elderly. And in addition to that, it also improves your balance, the motor coordination, flexibility, physical strength, improved tolerance for sitting for longer duration, keeping your joints healthy, enhances your lung capacities and improves your cardiac health, helps with reducing comorbidities like hypertension and diabetes, reduces depression, again improves your memory, cognition, improves quality of sleep, quality of life. So this is why yoga is very important in elderly. Now just skip these slides which are not important for us. Now looking at this, especially when we talk about elderly, most important complaint that comes is especially with the memory and cognition. Memory, cognition, sleep are very frequently reported problems in elderly. So these are huge trials that have been done that have seen that the mind body practices like yoga, tai chi, these are able to actually help people with mild cognitive impairment and dementia with improved attention, improved short-term memory, improved day-to-day functioning with the memory, visuospatial memory functions, that means the orientation to the space, and also overall global cognitive function. And also, they were able to show that their verbal fluency and ability to learn increases. And in these studies, there were, the duration of the sessions that were taken was 3 sessions per week, and the sessions were 1 hour long. And these effects were found after 6 months of continuous practice. Now, the other advantage with yoga is there are a lot of studies that show that yoga can actually offer neuroprotection, or actually protect your brain from shrinking down. Generally the brain shrinks with age. So this is yoga actually helps you to reduce this shrinkage in the brain. Now, as you can see that this dotted line and a solid line. Yes. So now this dotted line, people, who had not practiced yoga, you can see that their reduction in the brain size is so drastic. The line goes down. The slope is very drastic. But when you see people who practiced yoga, there is decline, but the decline is very slow. Okay. So yoga also offers neuroprotection. It reduces the or it delays or slows down the shrinkage of the brain, and it also improves your cognitive functions. As you can see that the cognitive functions in yoga group has drastically increased when you compare it to the control arm, that is people who didn't do yoga. On the other side, this is a test that you actually measure the number of errors that they do. So in yoga group, initially when compared to the before yoga, after yoga the errors have drastically reduced. However, in the control group who didn't do yoga, the errors have actually increased. They did more errors than in the baseline, that is before 6 months of the trial started. Further, we also could see on through MRI that the gray matter volume actually could increase significantly in people who actually practiced yoga for 6 months. And further, there is another study which is also an MRI study where actually chanting of Om could deactivate a few regions in your brain that are responsible for negative emotions. Okay, so chanting Om could actually reduce the activity of that negative emotion inducing brain regions. In addition, also this was not done in elderly, it was done in patients with depression, where after 3 months of yoga practice, they could actually see that there was increase in brain-derived neurotrophic factor, which is a growth factor that is required for increasing the brain volume, for the brain to grow. Now, secondly, another important thing that needs to be focused in elderly is their quality of sleep, which also translates into their quality of life. So in this very study, they could actually see that the quality of life and the sleep quality was much better in people who did yoga versus people who didn't do yoga. As you can see that the sleep measures, the time taken to actually get into sleep has reduced in yoga group while it increased in the control group. Again, the quality of life significantly increased in the yoga group, both physically and psychologically, whereas in waitlist control who didn't do yoga, there was a downward slope. Further, there were many studies that have been done in population with mild cognitive impairment, and they could actually, show improved memory and executive functioning, improved mood, and improved physical health in people with mild cognitive impairment. So this, they were also able to show that yoga was feasible in patients who actually had Alzheimer's dementia, and they were able to show that there was improved emotional well-being and reduced stress and anxiety in these populations. In addition to these factors, yoga basically could also help in reducing the comorbidities or also the severity of the comorbidities in elderly. There are more than 48 randomized controlled trials with high quality evidence that have been done and are able to show that yoga is very effective in reducing blood pressure, is very effective in reducing diabetes, and also in reducing non-specific pain symptoms that are very chronic. Now let us see a few useful yoga practices for elderly. So this is Trataka, which is a very useful practice for elderly. This practice involves, as you can see, that they sit in a group, okay, and there is a candle stand and a candle flame that is, placed on the candle, and you are actually the participant is asked to gaze at the candle flame until there is, tearing of the eyes, and after the person is able to register the shape, the color, and the appearance of the flame very well, they're asked to close the eyes and try to bring the image of the candle inside of their mind with their eyes closed, and they are asked to meditate on that flame. And once the image disappears, they again open the eyes, and this procedure is continued for 3 rounds. And after that, we do a certain kind of chanting and palming practices. After that, we give them deep relaxation technique. So this, this is one of the Shat Kriyas or the cleansing techniques. So this is very useful for the elderly. And the asanas that we teach the elderly are especially with the support of the props in supine posture or using some chairs. And very important practices that I personally would emphasize in elderly are pranayama and chanting. And then followed this session, we always end with a deep relaxation technique, and then taking a sankalpa or a resolution for the day. Apart from these practices, it is also important that they also adopt a few, lifestyle principles in their day-to-day life. So there are basically 4 types of major personalities that yoga identifies, and as you can see these personalities, the first one is Ramana Maharshi, the second one is Mahatma Gandhi, there is Mother Teresa, and there is Swami Vivekananda. So there are 4 streams of yoga. The one is Jnana Yoga, which is the path of intellect. There is a lot of questioning, and then you search answers from the ancient text through a lot of reading, contemplation. So that is Jnana Yoga. Karma Yoga is basically the stream of yoga where you do selfless service to the society or to people around you. And Bhakti Yoga is basically the path of emotions, where there is a lot of emotional culturing that you actually do by surrendering yourself to a higher entity, be it God or any other higher principle in life. And Raj Yoga is another path of yoga where you use your willpower and you do a lot of sadhana and tapas using your willpower. Now, how would you know which personality are you predominant with? When you ask yourself, or when you look into yourself and see what is the, how do you actually handle stress when you're stressful, or how is it that you react to stress? Few people would want to just sit by themselves and try to analyze the situation and see from where the stress is coming, how to, kind of counteract it. There are a few people who do not want to sit idle because they get stressed. They are always constantly into some or the other activity. There are then there are a group of people who would want to actually talk to people, express about their stress, actually, or pray to God or surrender to a higher principle. And there are people who no matter what, will not stop what they're doing. They use a lot of willpower and still do what they want. So it is not it is not like that ki you should only take one path of yoga. Like Dalai Lama is he actually adopts all the 4 paths of yoga, and what person he is. So it is possible that you also adopt all 4 streams of yoga, taking one at a time, and trying to inculcate into your lifestyle. So these are the 4 important streams. So ultimately, they again converge together for the nothing but calming the mind. Now let us look at some precautions that you need to take care while you practice yoga. One, it is very important that you not force yourself. It should be very slow and gentle and with mindfulness. And yoga is all about comfort. You're not going beyond your limitations or trying to kind of push yourself beyond the boundaries. It is very slow and steady. So you're always giving a mild stress, just maintain that. You're not exerting too much. And make sure that if you have low back pain or any cardiac comorbidities, do not do acute forward bends, like completely bending forward. And I recommend you avoid inverted postures, and especially in case of obesity and heart disease, definitely you should avoid inverted postures. Avoid fast breathing techniques if you have seizures or hypertension. Use wall support or chair wherever required. Try not to do postures away from the wall. That would increase the fall risk. And it is always important that you end the session with a good relaxation. And it is always better that you do yoga in a group so that there is more social bonding and you feel good. And you also look forward for these sessions. So, how many of you want to do a few pranayama practices now?
I think Dr. Most would like to do that, Doctor.
Thank you.
Most would like to do that.
Yes. Thank you for all your enthusiasm. So let us do the first practice. So these are few practices that are very safe. You can do it after food. There are no strict regulations. So this is called as the balancing breath or the Nadi Shuddhi Pranayama. So for this pranayama, your left hand should be in chin mudra. Can you see my mudra? Left hand. Now place this mudra on your thigh. Now your right hand is in Nasika mudra. Index and the middle finger bent down. Okay, now you need to use your thumb to close the right nostril. The other 2 fingers to close the left. Okay. Now come to the position. Now take a deep breath in from both the nostrils. Close the right nostril. Slowly breathe out from the left. Breathe in from the left. Close the left nostril. Breathe out from the right. Breathe in from the right. Close the right nostril. Breathe out from the left. This is one round. Let us perform 4 more rounds. Breathe in from the left. Breathe out from the right. Breathe in from the right. Breathe out from the left. Make sure your eyes are closed. Continue the practice for 3 more rounds. Can you continue the practice for 3 more rounds?
Yes, doctor. Yes, we will.
Just make sure that your inhalation and exhalation are very slow. Do not make any sound while you breathe in or breathe out. Your breath should be very smooth, without any jerky movements. Be aware of the touch of the air in the nostrils. Cool air entering the nostrils as you breathe in. Slightly warm air coming out of the nostrils as you breathe out. No pressure at all as you breathe in or breathe out. Gently stop the practice.
I have ended it with the left nostril, madam. Is it right?
Sorry?
I have ended it with the left nostril.
Yes, yes. Perfect. So when you finish the round, you generally finish it with the left nostril, breathing out from the left nostril. Very good. So the next practice that we will do is Nada Anusandhana. Sorry, Shastri sir, you said something?
No, that completes the cycle when
Yes,
we
correct,
close
correct.
it with the left.
Correct.
Thank you.
The next practice that we will do is Nada Anusandhana. This is the mind sound resonance technique. In this, we chant the syllables A, U, and Ma and try to feel the resonance with it. Okay, so we'll start with Akara chanting. Place your left palm in the center of your chest. Take a deep breath in. Now, as you breathe out, chant Akara loudly with your mouth wide open and feel the vibrations in your chest. Ah. Ah. Again, take a deep breath in. Ah. Feel the vibrations in your chest. Now place your fingers at the pit of your throat without any pressure, very gently, just touch the pit of your throat. Ukara chanting. Take a deep breath in. Ooh. Ooh. Place your hand on the top of your head, gently pressing against the top of your head. Makara chanting, take a deep breath in. Gently drop your head down. Keep your eyes gently closed. Try to feel the vibrations in your head region. Now let us chant Akara, Ukara, and Makara in a single breath in the ratio of 1:1:1. Take a deep breath in. Gently stop the practice. Keep your eyes gently closed. Try to look within yourself and feel the vibrations of this Ankara resonating throughout your body. Gently. Rub your palms together. Place the warmth on your facial region. A few blinks, open your eyes. So these are the two very safe practices that you can do anytime in the day whenever you feel a little stressed, anxious, or not able to sleep. These two practices would help you, come over a lot of stress or a lot of problems. And doing it daily also brings your system to a certain balance that can help you prevent a lot of disorders as well. So these are the very two safe practices that can be done. They do not have a lot of, prerequisites like empty stomach condition or anything. So these, this is the batch that we run every day from Monday to Friday, except the government holidays. We usually have sessions from Monday to Friday. So these sessions are basically for well-being and mental resilience, and especially it has been modified in a way that it can suit the elderly, and most of the practices are actually modified to be done on chair as well. So this is the Zoom meeting ID, and the passcode is 5 zeros. And we have the session from 6:50 a.m. to 7:50 a.m. You can make a note of it or just take the screenshot or the picture of the screen. I can also leave the details with Vayomanasa Sanjeevani team as well.
So YouTube link also please give.
We would actually want first, so that they first actually attend the session that are instructed and we see them. After that, we actually share the YouTube link in the session itself. So at least for a few sessions, 1 or 2 sessions, if you can attend the batch, and you can then avail the YouTube link to the module.
So that's one. I mean, that's one way you can see that people practice it correctly. So without any mistake, because I have attended this session, doctor. I have myself personally attended this session, but sometimes I'm not able to exactly join by the morning 6:50 a.m. That's the only. But anyway, let us try. And once after some time, I'll get the YouTube link also. That's also.
I have the same problem as Mr.
Definitely, sir. I just want to make sure that you attend 1 or 2 sessions with us. After that, definitely we'll give you the YouTube video. For us, the major interest is you practice it every day. If it is, even if it is not with us, at least you do it on your own sometime in the day, whenever you.
No, but keeping in view the last point you said as a group activity, when you do in this, though it is on what should I say, virtual, but still you get a little bit of feeling. Where once only doing single, sometimes even
becomes a little boring.
Yeah, even our mind also starts wandering. I mean, I'm just telling what practically what happens.
Yes, yes.
Very interesting.
No, sir. Nowadays, a lot of senior citizen groups are there. They are giving yoga classes. They are conducting yoga classes. Some group 8 to 9, some group 8:30 to 9:30, some group 7 to 8. There are a lot of senior citizen groups coming on Zoom. So even evenings also they are coming. So if at all you want a group like thing, you can join one of the group and definitely. And I am doing it. That's why I am doing regularly. I am doing morning. So
Very good. Very
no problem.
Very
No,
good.
even we have, we have Nightingale Medical Trust. We have myself and others, some of them, we have once in a week, apart from their physical exercises, and yoga is also there. But only once in a week, 1 hour.
No, these other senior citizen groups, every day they have got.
Oh. Which
There
one?
are 3-4 senior, at least I am a member in 3-4 senior groups. So all senior groups have got yogas.
Yeah.
Depending upon your timing, you can choose 7 to 8, 8 to 9, 8:30 to 9:30, whatever timing you want, you can choose. Every day it is there.
Correct, sir. See, to the question Mr. Ganesh has already asked. See, what is that? I mean, how do we internalize this? What is the minimum that we can do, say, daily, in say, half an hour to 45 minutes time? You know, Ganesh has very nicely raised that question, ma'am. I think I have forwarded that question to you as well. I think I'll just read that question. Irma, you have that question directly, readily with you, ma'am?
Yes, I have the question with me. Can you list simple minimum exercise for seniors? Say for 15 minutes to half an hour max, addressing easy mobility, strengthening knee and other joints. So yes, especially in elderly, what happens is, the joints become a little stiff. Okay, so it is a part of aging. So generally, because there is not a lot of activity where you move your joints enough. And also as a part of aging process, there is rigidity or the stiffness that sets in the joints. So the best thing that you can do is actually, trying to mobilize all the joints from head to the toe. So you can start with, neck, very rhythmic, slow movements at the joints. Like as you breathe in, you look up. As you breathe out, you look down. So This is neck forward and backward. Then you do the side movement of the neck. Then you do twisting at the neck. So people with cervical spondylosis or any vertigo related issue, vertigo especially, you sit and do not do the rotation if you have vertigo. Okay, do not do the rotation at the neck. Other movements can be done sitting on the chair, but people who have cervical spondylosis, you should first see what aggravates your pain. If you're comfortable, you can do it, but if you have pain, avoid the movement. Then next, you can go for the shoulder rotation, complete shoulder rotation. Okay. Then you do extension and flexion at the elbows. Then you complete rotation at the wrists. Then you open the fingers and clench. Open and again make a fist. So this finishes your upper body. Then you do waist rotation. And then you can sit down, and then you basically can do this. Hold your leg closer to the chest and straighten your leg. As you can see, so you can straighten the leg. So this takes care of your hip as well as your knee. And after that, you can do a simple ankle up and down and ankle rotation, and then toes open and close. So you doing this every day will actually help your joints to be very healthy. Okay, after doing this whole body joint loosening from top to bottom, everything for 10 rounds. This itself will take about 10 to 12 minutes. After that, the two practice that we have done right now, that is Nadi Shuddhi and the Nad Anusandhana, Avuma chanting. So this entire capsule will come about 20 to 25 minutes. So this is, if you do anything else or not, it's okay, but this core package should be a part of your routine if you're looking forward for some small capsule of yoga. And in addition, if you do not have blood pressure or hernia, if you don't have these two complications, you can also incorporate Kapalabhati, where basically your stomach. Okay, so you need to forcefully breathe out while you flap your stomach in. Okay, so there is no inhalation. You're only trying to exhale. Inhalation automatically happens. So only thing that you do is you're trying to basically push your stomach in to expel the air out. Okay. So this is another practice that is very useful for elderly, but it has some limitations with it. People with high blood pressure, any kind of heart ailments, or if they have hernia, they should not do this practice.
What is this known as, ma?
Kapalabhati.
Kapalabhati. Okay.
Okay. So this is the small capsule that you can incorporate in your day-to-day life. Just short, sweet, and addresses all your needs.
Thank you.
But that helps really, because as Shivaguru Sahib was mentioning, there are several yoga groups that are going on, and each one is talking about something, but may not be specific to senior citizens alone. So, but therefore, taking something from you, from an expert on this, is the best medicine. The best advice that we can take on this, doctor. Thank you very much for that. Any other question from any other participants, sir?
No, sir. Only in addition is that there are those yoga experts only. They are coming and teaching. And as she said, each and every part is not full one day they are not covering, but slowly throughout the week, one by one, they will be covering the parts of the body, exercises and yoga asanas for those things. So that will be very good. It's guided one only. It's not that somebody is coming and it's all.
I agree. I agree.
Yoga teachers.
I agree. There will be definitely yoga teachers. They are qualified people, no doubt about it. So, but let us remember the NIMHANS is the top in the ladder, sir. So, yeah, that is the
Percent to percent, how much advantage you want to take it, you take it. Everything is available.
Actually, students, what they are thinking, sir, actually, I'm a yoga teacher only. They are paying, for that payment, they just want to learn everything in the same day itself. We just, what the sir said, it is true. We are just going beyond their, we know the limit. So per day, this asanas, if we are starting from the bending, then the lateral, then the supine, then the prone, then back arch, like that. Gradually, we are teaching them, but some of them just want to learn fast and fast. That's their problem. And finally, they just telling the teachers doesn't know anything. They are lazy like that. It's happened.
No, it maybe that's maybe one or two people like that, but it's all senior citizens. This is for senior citizens, so they are going very slowly, and people are also following whatever the instructions they are giving. It's not that they wanted this.
Actually, my profession is I am a MSc nursing, OBG specialty. I'm done PhD in my specialty nursing itself, and I already gone through a international yoga certificate holder. And I'm taking students 35 plus only. I'm not interested to take the kids because 35 plus, we can't expect many flexibility in their body, The kids can keep their legs, hand and everything wherever they just want to fold, they can. But think about the 35 plus, especially in females, definitely they have some problems on their back and the abdomen and thigh muscles. So we just focused on that particular area, what asana is suitable for them, and how the doctor said, the pranayama.
No, you are muted.
You have muted, ma.
And we just teaching them to do some pranayam and everything.
That's nice. Very nice to hear, ma.
Thank you, sir. Thank you, sir. Such a teachers. Actually, it's my interest. I've seen this Zoom link last week itself. There they mentioned if any previous or related questions. I was wondering when I supposed to attend this Zoom link.
Well, you are welcome. You are not only for this Zoom meet. You are always welcome. Every alternate Monday we have got this Zoom meeting, ma. You are welcome. You can join us. I will please type your number in the chat box so that we can also include you in our mailing list.
Excuse me, sir. That Zoom link is, if I have written correctly, just check it, sir. 9580857044.
Yeah, correct, madam.
9580857044, right, ma?
Thank you, sir. Tomorrow I wanted to join, that's why.
Five times 0 is
5 times 0. Okay. Thank you, sir. Okay.
That's right, ma. That's right. Is there any other? Would any other participant like to ask any other thing, ma? Anything?
Sir, just I want to know the timing for yoga, sir.
Pardon me?
Timings for yoga to join the class, sir.
6:50 a.m., madam. 6:50 a.m.
Okay, thank you. Thanks.
Really, the job done by Dr. Lakshmi.
Jampanathan, I have a question. I have a question. Can I ask?
Yes, sir. Please.
Yeah, can you kindly explain the science behind Anulom Vilom, madam?
May I know who was asking the question? Shastri, sir?
No. I think it is
the science behind Anulom Vilom. What is the importance on the body and the mind?
Doctor, before that, I'll tell you, Mr. Nagaraj Rao is a specialist, is a yoga specialist. And in fact, we are learning pranayama from him. He regularly conducts classes. He regularly.
Sorry to say, I'm not a specialist. I'm only a follower.
But as far as we are concerned, we know that you are a specialist. Anuraman Viram, he is talking about that.
Yeah. So, Nadi Pranayama, as explained in the ancient text, Nadi Shuddhi. You know, when you split the word Nadi and Shuddhi, Nadi meaning the energy channels, okay, where the prana flows. Shuddhi is basically cleansing. Okay, so the activity that we do constantly, you know, as any other system, when it works, there is, friction that happens, and there is, sediments that actually keep settling down. That is why you give your motor vehicles for servicing, right? So this Nadi Shuddhi is basically like a servicing where it removes all the sediments or any blockages or anything, any imbalances, sometimes, especially prana is basically energy, okay? So energy follows a law, that is, it can neither be created nor destroyed. It can be just transformed from one form of energy to the other form of energy. Okay, so the same follows for the prana as well. So the prana can be more in your head region. That doesn't mean that there is more production of prana in your head region. Rather, somewhere there is prana that is less because the prana has accumulated more in your head. Okay. So now what Nadi Shuddhi does is it's like a servicing where it is trying to balance the energy throughout the body, that is left and right, and also, from in the longitudinal axis. So it balances the energy, it removes any impurities or any, sediments that settle in your energy body. Okay. And there is a lot of research on Nadi Shuddhi Pranayama. So this is the perspective from the ancient texts. So that is why it is called as Nadi Shodhana. And it is a very important practice before you actually go into any higher meditative practice or any advanced pranayama practice. On the other side, when we look at the research and the science behind it, so Nadi Shuddhi, when you do Nadi Shuddhi, so at the edge of the nose, okay, so there is a tissue just below the olfactory bulb, which is called as the spongiosum tissue, which has the sensors for touch and temperature. So that is why we give this instruction saying that you be aware of the touch of the air in the nostril. Okay, without that component, the pranayama actually doesn't work. So when you do that, so this spongiosum tissue that is there inside, it is able to sense the touch of the air. And that touch is communicated to your higher brain centers, especially to your hypothalamus. Okay, so that part of your brain basically has the centers for all your vital functions, your heartbeat, your blood temperature. So all the important functions of your body, the center lies in the hypothalamus. And also, there is a lot of research that shows that it is able to bring better control, over the blood pressure, reducing the respiratory rate, reducing the heart rate, and improving the vagal balance, which is very indicative of any disorder that any lifestyle disorder that we talk these days, diabetes, you take hypertension, any psychiatric disorder, any, chronic non-communicable disorder. So most of the disorders talk about there is imbalance in the two types of nervous system. So this basic, pranayama basically brings. So there are two types of nervous system. One is called as sympathetic nervous system. The other one is called as the parasympathetic nervous system. So sympathetic nervous system is something that helps you to, fight a stressful situation, and then parasympathetic nervous system is something that helps you to relax. So because of the chronic stress that we undergo, the sympathetic nervous system doesn't come back to the baseline, and the vagal system doesn't optimally come to its capacity. So this pranayama basically helps to bring the sympathetic nervous system back to the baseline, and when not required, it doesn't allow the sympathetic nervous system to be active. Rather, it will help the other relaxing kind of nervous system, that is vagal or the parasympathetic nervous system, to be active and help the person to relax and have better mental relaxation.
Why I have this question is, in case of autism, mostly it is said that it is the imbalance between these two which creates a lot of problems. Can this be recommended for for students or people with autism? Can this be of some help for them?
Definitely of great help.
Why this is not being introduced in all the hospitals, doctor?
That is because there is a lot of impediments for the actually the yoga to be, a lot of people do not believe, or they do not actually take the science of yoga. Otherwise, people who actually are into it, they definitely have yoga as a part of their clinical practice.
Yeah. Thank you. Jamunathan, over.
Thank you, sir. Thank you, sir. Sir, I was just wondering whether our participants from Croatia will also.
Excuse me, madam. Hello.
Go ahead.
This 6 times I'm doing Surya Namaskara after doing all the types of yoga asanas. Is it enough, or can I increase it to 12 times?
What is your age, madam?
I'm 55. I'm lean and okay, I'm active.
Any joint pains that you have?
No problem like that.
You can do 12 rounds of Surya Namaskara, but very slowly.
Slowly we can increase to 12 times, no?
Yes, you can increase 2 rounds of Surya Namaskara per week.
Per week.
Yes.
Okay. Can it be
and
increased
you
like
stop
that
it
only?
till 12 Surya Namaskara and do 12 Surya Namaskaras only thereafter.
Pardon me?
So once you come to 12 Surya Namaskaras in total, you maintain at 12 Surya Namaskaras, don't increase it further.
Okay. Thank you, madam. Thank you.
And the pace of doing Surya Namaskara should be slow, and it should be coordinated with breath.
Which is better, madam? One asana, it has 12 counts, no? Surya Namaskar. One
Correct.
count, I have 10, I can count it for 10 times, like that, 1 to 10. I can stay there, then go to second asana in the Surya Namaskara, then stay for 10 counts, like that. Which is better, doing continuously or staying for 10 counts?
In a particular posture, probably you mean.
Posture, same posture. First posture
Maintenance is better than repetitions, especially in terms of yoga. But initially, you might not be very comfortable doing it for 10 counts. So if you want, first you can do repetitions, and then you can make a transition to maintenance for 10 counts in each posture.
So that is equal to 12 times, doing what we firstly we are doing for 10 times or 12 times.
Yes, so if you're doing maintenance with 10 counts, you can just do 3 Surya Namaskaras with maintenance for 10 counts in each posture.
Okay, madam. Thank you. Thank you so much.
Any other doubts, ma'am? Any other doubts, sirs? We have already, I should really thank doctor. We have already workshop. We have the seminar is it was very interesting, doctor.
It's very commendable, by Dr. Lakshmi Nishitha.
Thank you so much, sir. I'm really humbled seeing all of you.
We are also happy. In fact, we look forward for more such interactions and talks.
Yeah, so that people who know things and who can also, help us find out in an authentic method, in an authentic way, with absolutely no intention for marketing any particular thing.
Yes.
See, with the first other seminars that we attend is that they have got some, they either want to promote a brand or they want to either, talk of a system, something like that. So they have got some marketing in their mind. Here it is absolutely this. Vayomanasa Sanjeevani is one of forum where we don't have anything to back at our back. We do not market anything. We do not endorse any brand. We just, we get experts to talk only on matters connected with elders' health, and that too in a non-judgmental way. See, they just tell you this is all what it is. You just take what you want. So that kind of seminars we rarely come through. Therefore, this is the reason I would request all senior citizens not only to themselves attend these seminars. It's only on alternate Mondays, say about 1 to 1.5 hours. And every time we are getting experts like Dr. Lakshmi Nishitha J. Last 15 days back, we had 5 panelists. Each one of them is an expert in his own field. And each one of them can talk for 1 hour. And they have got lots of things. But let us also remember one thing, sir. These people have accumulated their knowledge over a period of time. If you expect them to transfer everything within, say, 40 minutes or 45 minutes, it may not be possible. See, they can just give, as Dr. has pointed out right at the beginning, they can give you a bird's eye view of what is what. And, they also give you where to go in for more, and which is the best source to get more. So you use that source and improve our knowledge. Therefore, it is very nice of you, Dr. Lakshmi Nishitha, that you came, spent so much of your time and energy to tell us what you know about yoga and how far the yoga will be useful to us. And besides that, we would like to have a session with you on other topics on which you are an expert. Like, you have got naturopathy also. Naturopathy, naturopathy.
Definitely would like to have naturopathy if you got. Whatever your knowledge, if you want to give us, it's not possible for us to take everything. It's impossible for us. So you are really good to give what exactly is required. This is what you require. This much only for you. This is not more than this. So that's what I like. And in naturopathy also, if we can have one more session, definitely we like.
And so similarly, acupuncture. She is also specialist in acupuncture.
Good.
So in fact,
at least naturopathy, acupuncture, acupressure.
Acupuncture, I think she is as far as this thing. She is an
acupuncture difficult. Acupressure is at least okay. We can practice a little bit. Acupuncture practice is difficult.
I agree, sir. I agree. At least we can we come to know that these things are existing and we can use them. See, we try to get treatment in drugless treatment. I don't consume any tablets, but at the same time, my ailments are attended to. I'm becoming better. So this is the mantra that we are trying to follow. We like to avoid chemicals. So these are all the areas. Yoga is one area, acupressure, acupuncture, they are all another. There's another area. Then naturopathy is one more area. I think she is 3 in 1. Round into 1. Therefore, we will. I will.
Yamunathan sir, then just arrange for one naturopathy, whatever it is. Let us one more session.
Yes, sir. We will request. I will request
we look forward with the doctor.
NIMHANS, so that we look to something. In fact, we want some expert to talk on that without some, marketing motive. That's an important take home lesson. Take home point for us in this Vayomanasa Sanjeevani, webinars, madam. So thank you very much for sparing your time, energy, and your knowledge for us, madam.
Thank you so much for giving all your time.
Thank you very much. Thank you.
Thank you, ma'am. Thank you, ma'am.
Thank you, ma'am. Thank you so much.
In return, what we can do is we can only pray God to shower on you all the best in your life as you are in your prime of your life. She is hardly 29 years old. although he is experienced, highly educated. Therefore,
No, sir.
we look forward to your continuous engagement with us and your well-being, your growth. For all of it, we pray God to shower on you all that are the best in life. Thank you very much, ma'am. Thank you. God bless you. Lima.
Yes, sir. Okay.
I will now hand it over to Lima. And my request to all of you is that please do attend such seminars in future also. Thanks for attending the seminar. See, the webinars are being organized on every alternate Monday. Yes, alternate Mondays. Therefore, please do attend. Whoever is not getting the, the invitations or the information, please send us a mail or in the same WhatsApp number, your number. It can get registered, and our team will be able to send you the invitation in future. Thank you very much for all the things. Lima, you might take over. Thank you.
Thank you, Jambunathan sir, for moderating the session, and be really grateful to you for your continuous support to us. And I would like to thank Dr. Lakshmi Nishitha for the informative and enriching session on yoga for us. Thank you so much, ma'am. And I would like to thank all our Zoom and YouTube participants for joining with us today. Thank you all. And I would like to thank our partners, Government of Karnataka, Indian Psychiatric Society Karnataka Chapter, Karnataka Legal Service Authority, Bangalore Apartment Federation, Happy 60 Plus, Samadhana Counseling Center, REC Foundation, Icon Life Sciences, and NSC Foundation. Thank you all. Have a good evening.
Thank you, ma'am. Thank you.
Thank you. Thank you.
Thank you, sir. Thank you. Thank you, everyone.
Thank you very much.